Hi there, my name is Victoria Lay. I am currently a graduate student at Mount Mercy University. Today we are going to be discussing vulnerable populations in regards to refugees and immigrants. Objectives: we are going to review characteristics and values of the refugee and immigrant population, describe contributing factors that lead to vulnerability and health disparities, examine how theories of multicultural vulnerability are implemented into nursing practice, examine how personal values and attitudes correlate towards having cultural competence, review social justice and ethics within public policy and nursing practice, and describe nursing education that should be utilized within healthcare to support refugee and immigrant populations. So, characteristics and values. There is currently a refugee crisis in the world. There are over 70 million people in the world that are displaced, which includes refugees and immigrants. There are over 3 million refugees living in the United States whose health and well-being may be diminished due to not being able to understand and use the health information. So refugees and immigrants, they are leaving their home for a better life for their family, for a new job, for higher wages, or better education. They're forced to leave due to persecution in unsafe living areas, in their home area. Due to human rights violations, having torture, being targeted for who they are. The risks to their safety, were so great that they had no other choice but to leave and seek safety outside of their country because either their own government cannot or will not protect them. So here in the United States, when they come, they have limited access to resources to meet their basic needs, such as housing, healthcare, sanitation, education, and employment. Factors leading to vulnerability. So being displaced due to war and violence. This leads to higher rates of mental health disorders, including anxiety disorders, post-traumatic stress disorder, and depression. This is due to the experiences that they've had, due to war exposure and past trauma. The resettlement process leads to high stress due to living in a new setting, partaking in practices that are outside of their normal, and they also have, lack of familiar support systems. These populations generally have trouble finding employment and adapting to the new environment culturally and linguistically. There's a higher rate of morbidity and mortality for many reasons, due to their situation from their home country, conditions in their refugee camps because they're overcrowded and not sanitary, as well as undernourishment. So multicultural nursing, consideration of values and traditions, using preventative health measures for certain populations such as mammograms, cancer screenings, diabetes screens, or prevention. And this is just used to reduce health disparities through early access and treatment, as well as respecting patient preferences and improving patient engagement in the decision-making process. Culturally and effective interprofessional care. So developing a better trained healthcare workforce that understands the unique needs of refugee and immigrant populations. Cross-cultural training. So this is for healthcare professionals to increase knowledge development and change attitudes towards the refugee and immigrant populations. It helps get a better understanding of migration and its effects, on a patient's health. It helps the healthcare professionals understand the role of culture in regards to mental health and reasoning. It also provides providers with a new perspective to promote empathy, as well as empowering, healthcare professionals to be more curious and courageous to stand up for certain values and to do the right thing for their patients. So, significance of cultural competence. So this is the definition of cultural competence: the ability of systems to provide care to patients with diverse values, beliefs, and behaviors, including tailoring delivery to meet patients' social, cultural, and linguistic needs. So refugee and immigrant families have unique and complex needs due to the forced displacement and resettlement. Cultural competency provides an, effective and equitable service delivery to help reduce health disparities, improve access to services, in healthcare, social service, employment, and education. The biggest thing for cultural competency is self-awareness, and respect for cultural diversity. So healthcare providers should evaluate their own culture, their own beliefs and values, as well as their biases and how those influence their care for this population. They need to do this in order to relate to them. They need to first know themselves. So this can help providers from making assumptions, generalizations, and stereotyping these populations. The biggest thing to do is just to have open, honest conversations regarding differences in cultural beliefs, in order to have acceptance for each person. Personal attitudes and values. So personally, I believe that being healthy is the most precious thing in human life. There's a duty as a nurse to provide empathetic care for all people, no matter their background, beliefs, or values. Personally, I just want all people to feel comfortable around me. I want to build strong, trusting relationships in order to create a safe space for my patients to have growth and succeed. Social justice and ethics and nursing education. Um, so nursing care needs to be according to the need without bias or prejudice. So having respect for human rights, cultural rights, right to life and choice, and to be treated with respect and dignity. I think there needs to be an advanced public health and well-being. So administering to the needs of marginalized populations, working to change legal and social structures to advance. So this is, continuously throughout practice. And like I said before, the biggest thing is to win and maintain a trusting relationship. So, this is key to establishing positive and open relationships with patients in order to make them feel comfortable to speak up and ask for what they need. It's also important to recognize the impact of stressors, on this population. So do they have mixed legal status? Are they legal or are they undocumented? Because sometimes immigrants, they come legally, but then they let their visas expire, and then they kind of have to tiptoe around in fear of being deported. So it's important for nursing staff to, express to immigrant patients that, you know, as a nursing staff, we will not report to the federal immigration officials any information concerning immigration status. So putting that out in front, and helping them understand that whatever they say, and whatever they need help with, we can help and we won't, turn them in, or they don't have to fear of being deported. Um, Another big thing is development of health education and promotion materials. So these should be sensitive to refugee and immigrant health. It should be sensitive to their language and the health literacy, sorry. How do they understand? And then giving them, education that they can understand and they can use. So this will help improve health conditions for them, as well as considering, their values and traditions. Public policy. So the Cover All People Act in Oregon, it extends state-funded coverage to all low-income adults who are not eligible due to immigration status. This also it also provides state-funded premium subsidies to immigrants who are ineligible for federal premium subsidized due to immigration status. So as we all know, accessing emergency care can cause fear, as well as the cost of an emergency room visit may be very extensive. So these populations actually choose to go without medical care that they need and that they deserve, which can result in, compounding health problems for themselves and their family, which leads to worsening health disparities. So this can further disrupt a person's future in regards to access to education, getting a job, and caring for themselves and their family. So the biggest thing to do is just to ensure access to healthcare, because with, timely treatment, we all know that that's vital That's a vital preventative measure. So the healthier our refugee and immigrant populations are, the healthier we all are as a community. Literacy to vulnerability. So low health literacy combined with limited English proficiency leads to poor health and barriers to health related resources and needs. So these patients, they might not understand the diagnosis in their clear care plan, which could result in delays in preventative services, missed office visits, and unmanaged acute conditions, as well as exacerbation of chronic health conditions. So what's the importance of health literacy? So we need to understand the effects of limited English proficiency because it's directly correlated to poor health status. It's important to obtain, understand, and use health information that is unique towards, a person's unique needs. Health professionals need to take on the responsibility to deliver understandable and usable health information. A little bit of an overview here. As we were just talking about, limited English proficiency is one of the most challenging aspects of the resettlement process for refugees and immigrants. And their need to seek medical care. Healthcare professionals need to understand the unique needs of the refugee and immigrant population in order to provide them with the appropriate care that they deserve. Healthcare professionals must respect human rights, cultural rights, and show them empathy and dignity. And to do this, creating an open and honest relationship in order to gain and maintain that trust will allow for positive outcomes for our refugee and immigrant families. And here are my references.